Greetings, my name is Harold Almond and I'll be reading stories today from my grandfather's book, The Stories of a West Virginia Doctor. My grandfather, Dr. Harold Almond, practiced medicine here in Upshur County in West Virginia for many, many years, and of course was an inspiration not only to me but to many in the community, and I'm happy to read from his book today. We'll be looking at part 4, Animal Stories. Again, so Harold Almond reading from Stories of a West Virginia Doctor from my grandpa, Dr. Harold Almond. Part 4, Animal Stories. Attack at the Farm Pond. A doctor's practice in rural West Virginia is different from a practice in a city or a metropolitan area. It is more adventuresome. The unexpected is common. It is expected. The following exciting case comes to mind when I think of animals that attacked my patients. The coal miner and his 5-year-old son were enjoying the summer holiday by fishing in a farm pond. All of a sudden, the son screamed out in terror, and the dad saw a small dog attacking his little boy. He dropped his pole and rushed to his son's side. He grabbed the animal by the neck and twisted its head off. Father and son hurried to the office that evening to see me. The father's tale sounded like the dog had rabies, so I told the father that he should have brought the head in for a microscopic study. The reply was, "I did." So I sent my nurse to view the head and see if we had a container suitable to put the specimen in. The nurse came back looking like a ghost and vomiting. It was the most hideous thing I've ever seen. Even I felt nauseous as I put the head in a glass jar to take to the health department the next morning. The dog was, in fact, a small red fox. As we always did to be safe with a potential rabies case, we started the first of 14 rabies shots that night for both the father and the son. Laboratory tests later proved that the fox had rabies. Doubting the health department. It was mid-morning one August when a little 4-year-old girl saw something moving in the tall grass. She was curious, and so she investigated the moving animal. It was a small bat, and the bat bit her immediately. Her screams brought her mother, and her mother grabbed the bat and placed it in a gallon jug, over which she threw a burlap potato sack. She found the jar lid, punctured it with air holes, and headed for our Buchanan office. My registered nurse and I viewed the bat. We knew that healthy bats are not found on the ground at mid-morning, but are sleeping in the trees for the day. We recalled that a month previously we had treated a miner's son for rabies when a fox bit him out at the fishing pond. The other incident had occurred about 2 miles away. As was always my practice with rabies, I started the first of 14 painful rabies shots in the girl's abdomen wall that morning. We personally delivered the jar with a live bat to the health department office for shipments to the laboratory. The laboratory froze, sliced, stained, and studied the brain tissue. On the 8th day of treatment, the health department informed our office that the bat's brain did not show rabies. Should we stop with the clock? No.
No, not if you talk loud enough.
Okay. Let me start the story again.
Okay.
You can edit.
Yeah, that's a good question, because we had that discussion beforehand.
Oh.
We didn't talk to you about it.
That's
Okay.
a long time for 3 o'clock.
So I'll start again.
Okay.
Doubting the health department. It was mid-morning one August when a little 4-year-old girl saw something moving in the tall grass. She was curious, and so she investigated the moving animal. It was a small bat. The bat bit her immediately. Her screams brought her mother, and the mother grabbed the bat and placed it in a gallon jug, over which she threw a burlap potato sack. She found the jar lid, punctured it with air holes, and headed for our Buchanan office. My registered nurse and I viewed the bat. We knew that healthy bats are not found on the ground at mid-morning, but are sleeping in the trees for the day. We recalled that a month previously we had treated a miner's son for rabies when a fox bit him out at the fishing pond. The other incident had occurred about 2 miles away. As was always my practice with rabies, I started the first of 14 painful rabies shots in the girl's abdominal wall that morning. We personally delivered the jar with a live bat to the health department office for shipment to the laboratory. The laboratory froze, sliced, and stained and studied the brain tissue. And on the 8th day of treatment, the health department informed our office that the bat's brain did not show rabies. My nurse and I were surprised. We supposed that the animal pathologist was looking at a frozen section and not paraffin sliced tissue that had been stained. As an intern, I had seen frozen sections of breast tissue. Later, I'd seen the same tissue prepared into paraffin, sliced and stained with dyes. The frozen tissue was too difficult for me to read. I mused over the telephone report from the health department. No rabies in the bat's brain. 8 days before, 8 shots ago, I had been sure that the bat had to have rabies. There were 6 shots more, all to be given the little girl's abdomen, and all very painful. I was on the spot. My clinical judgment said, yes, the bat had rabies. I was cautious. I gave my little patient the other shots. My worry was over. About 10 days later, an excited young woman from the state health department called, "Do you remember the little girl who had the bat bite?" We replied we couldn't forget her or the little boy who had been bitten by the fox. The voice quickly stated, we had reported to you that the bat had no rabies, but in fact, the paraffin test showed up the negri bodies. The test is positive. We startled her by telling her that we had already given the little girl all 14 shots. We had not trusted that first report. With relief, she asked, "You didn't believe our first report?" She must have turned to her boss, for we had heard her say in a muffled voice, "Thank God someone doesn't believe the health department." The health department representative warmed our hearts that day with her comment. We had made the right clinical decision, and our little girl would be all right. The doctor's dog. I can't remember exactly when our family collie started to make country calls with me. I think perhaps it was after a local policeman asked me who I was talking to as I rode by one night in my little Jeep. I was talking to myself out loud, partly to keep awake, but partly because it was lonely out there. Some trips were 30 miles to Helvetia and 30 miles back, often at 30 miles per hour over curvy roads. At any rate, the policeman's look was odd. A doctor talking to himself out loud? That's when Ralph started occupying the passenger seat in the Jeep. Ralph was the son of a thoroughbred collie. Our family got him early in the fall, and all winter our 5 children played hide and seek with Ralph. They hid his mouse, a glove, or a stocking, and he loved to have a stick or ball thrown, and he loved to fetch it back. He was truly perpetual motion. Ralph often accompanied me to my office. One afternoon, he went to the office with me where I was to see a sick baby. Lost in thought about the baby's sickness, I prepared to leave the house. I barely heard Lois's request to pick up her repaired shoes at the shoe store, which was right down the street from my office. I forgot, of course, to take the identification slip for the shoes. In fact, I left it on the kitchen table. The baby was not too sick. I had worried needlessly. Yes, I remember the shoes, but I couldn't find the identification slip. The shoemaker and his wife were patients, so I went to the store anyway. But once there, I realized that I didn't know the size, shape, color, or what repairs had been done. There were some 60 or 70 pairs of shoes in the shop that day. Empty-handed, I walked back to my Jeep in my office parking lot where Ralph was waiting for me on the passenger seat. He wagged his tail and wanted his nose rubbed. Ralph seemed to say he could help save me a trip home to get the identification slip. I had an idea. Together we returned promptly to the shoe repair store, and I told Ralph to go sick the shoes. He started down the row and past the customers and the owner. All were silent and all watched. Suddenly, Ralph's tail went around in circles as he picked up a brown pair of newly soled and heeled women's shoes and brought them to me. The shoe repairman was speechless when I asked the price of the pairs for Lois's shoes. But fortunately, his wife spoke up and took my money and placed the shoes in a poke. "Did you get my shoes?" Lois asked on our return. "You forgot the slip. It's here on the table." "Your shoes are in the bag here." I picked them up and handed them to her for her inspection. Yes, they were the right shoes. She knew I couldn't possibly have known which shoes to bring home, and I grinned and asked her to give Ralph a hug and a slice of cheese for being my friend and companion and having a good nose. Indeed, doctors need help from wives, children, nurses, and at times, even from our dogs. My protector. Man's best friend is his collie dog. The Almonds have had many collies in the past, 48 years in Buchanan. They have been all gentle, affectionate companions for the entire family. Most of our collies were named Briar or Briar Boy. Occasionally, we slipped in another name like Ralph, who was the son of a Briar. One summer night, Briar of that day and I made a house call somewhere above Alexander. At 2 a.m., we slowed down our little Jeep at the railroad crossing before climbing up the first hill. Early in 1950, it was unusual to ever meet a car after midnight once I left the city limits. The tavern in the old Railway Express office was closed, but I noticed 5 or 6 men loitering about. I heard one of them shout, "Let's get 'em!" I drove up that hill as fast as I could, and much too fast on that straight stretch before the next hill. but their car caught up with me on the uphill and drove me off the road. One fella ran around the Jeep to the side door and opened it. In my fear and anger, I told Briar, "Get him!" And Briar went crazy. He growled and bit the fella across the wrist. He instinctively attacked that man to protect me. I shouted, "Mad dog! Mad dog!" The fella dropped his idea of entering the Jeep and screamed out loud to his companions, "Mad dog!" I spun the wheel and up the hill we flew. I never knew if it was a holdup for my little money or if they were after drugs in my medical bag. This was the only time I was stopped or held up in my 40 years of practice. Briar got a big hug and an extra slice of cheese when we got home that night. Collie medicine. At the office one morning, I shared a phone call with my staff because I did not know how to handle a problem that my patient was having. A woman had called about her mother, who lived in her home. The elderly mother, who was blind and bedfast, had called her daughter back to her room for the umpteenth time that morning, saying there was a boogeyman under her bed. The daughter, for the umpteenth time, told her there was no boogeyman. She even got down on her knees and hands and lifted back the covers. But the blind can't see, and now the daughter, usually full of patience, was worn out and getting worried. What kind of medicine could I give this elderly woman to ease her mind? Modern medicines are life-saving, but even the psychotropics wouldn't work. Hypnotism? But then this doctor was not educated in that field. When I entered the house, I was met by a big barking collie, but his swaggering, wagging tail was a giveaway. He was friendly, it turned out. Shep was grandmother's favorite, next to the grandchildren. Each day he went back once or twice to see the grandmother. Man's best friend turned out to be the doctor's best medicine, for he followed me back to the grandmother's room, and with a little urging and lifting, he put his heavy paws on grandmother's abdomen. As the collie leaned against the grandmother, I commented on the weather, the crops, the children, the preacher, the latest TV news, and a little about strawberries. Grandmother was appreciative of the attention and the news, but then Shep was getting heavier as time passed. She stirred and changed her position, but then I deliberately told her a story or two more. The 60-pound collie became heavier and heavier for Grandma the more I talked. Finally, I asked the elderly woman if she liked her collie dog, and when she answered yes, I asked the dog to bark if he spotted a boogeyman under the bed. Much to my relief, the big, gentle collie stayed silent, and Grandmother was convinced that the boogeyman was gone. Suddenly, Grandmother told her daughter that she was hungry. She had been too worried to eat all day long. I bid the elderly woman good day and gave her big collie an affectionate rub before I headed back to the office. The worst snake bite. Snake bites were not common in central West Virginia, but we Upshur County physicians collectively saw 3 or 4 cases each summer. Usually snake bites are painful but not fatal when properly treated. However, our hospital staff always recalled one serious incident whenever the subject of snake bites came up for discussion at staff meetings. It was 1 hour after dark, and the young farmer's wife made her last call to the outside necessary house. A copperhead struck her on her instep. It wouldn't let go with its fangs. Her husband came running when he heard her scream. He grabbed the snake by the neck and eased the fangs loose. I suspect the venom from that large snake must have been in a large quantity and must have been potent. I recall the phone call from the excited daughter. I still hear her mother crying out in pain. I gave directions for an ice bag and a tourniquet to be applied. The family brought the patient by car from Hacker Valley, some 30 miles away. When the patient arrived at the hospital, her foot below the tourniquet was black. I injected the snake antivenom near the wound. We enlarged the bite and washed and rewashed and applied the tourniquet up the leg in 6-inch segments and gave more antivenom. We packed her foot in ice and gave her morphine for the pain. The patient was a hurtin', as they say. 8 or so times during the night, the nurse loosened the tourniquet. I administered more of the antivenom. The patient's foot and ankle were as black as the starless night. By morning, the tourniquet was at the mid-thigh. The foot, leg, and lower half of the thigh were black. Oh, so black. The bite was serious, the worst I had seen. Both the consulting doctor and I thought she would lose her leg and maybe her life. We gave her several blood transfusions. The wonders of the anesthesia were appreciated that night. For the next few days, we covered the snake bite of the lower extremity with ice, and fortunately, at that time, we could get all the ice we needed at the local ice plant. Thankfully, appropriate medicine, good nursing, and lots of prayers brought about her recovery. And yes, That outside necessary house was properly set on fire, as the husband had promised. He finished their inside bathroom before his wife was discharged from the hospital. Treat my dog first. The telephone call was from a country store at Selbyville, 30 miles upstream from Buchanan. The elderly patient lived another 2 miles upstream from Selbyville, across 2 submarine bridges. She had been itching all over for 3 weeks. Now she had diarrhea, and she was out of her mind. About 90 minutes after the call, I crossed the second submarine bridge, parked my little Jeep, and headed up the country road. It was uphill, and I was soon out of breath. An old man standing at the intersection of the road asked me where I was going. I replied that I was a doctor. He seemed disappointed, but he admitted that the patient was his wife. He said he had expected one of the older doctors, not a young fella. In fact, he told me I was too young to doctor his wife. I was now the disappointed one, having traveled 30 miles for no pay. As I was contemplating my predicament, I noticed the old man's coon dog had the same symptoms that had been described as those of the old man's wife. The dog was scratching himself, running around in circles, and had diarrhea. I remember back to my medical school days when I had seen Chicago folks who had scratching diarrhea and seemed to be out of their minds. Back then, we had been instructed by Dr. Tom Spies, a nutrition expert. He told us about the 4 Ds: dermatitis, diarrhea, dementia, and death. Over the phone, it sounded like this patient had 3 of the Ds. So I brought along niacin, vitamin pills, and even some big liver capsules. I'd also brought along a bottle of intravenous niacin and 13 other vitamins. I stood there on the path thinking, if I couldn't treat the old man's wife, then would he let me treat his dog? Yes, he said, he is hardly a dog anymore. I offered the dog a handful of vitamin pills plus the liver capsules. The dog wolfed them down. 4 days later, the Selbyville storekeeper called again. He told me I'd cured the coon dog and I was invited up to treat the old lady, the man's wife. When I called on her, she had pellagra, the disease of the 4 Ds. I gave her the same medication I'd given the old dog, vitamins plus the liver capsules. I gave her a list of foods heavy in the B-complex vitamins. She too made a rapid recovery, and I treated that family for the next 10 years or so. The rabid horse. Early in the 1950s, many farmers still used horses to plow their fields because West Virginia farms are hilly. The hills are too steep for tractors, and tractors cost several $1,000s more than a team. Eventually, horses were replaced by a small tractor, but in the early part of my practice, horses were commonplace on farms. Seldom, however, did we ever see an injury caused by these normally gentle work horses. One morning, we were paged at the hospital, and the telephone report was that a farmer had been bitten by a rabid horse. At the hospital, I examined the farmer's bite. It was a nasty gash. The muscles about the shoulder were torn, and the deficit was 4 by 8 inches. Dr. Page, our surgeon, worked hours restoring the farmer's injured muscles and tendons. The hospital notified the health department, and they in turn employed the local vet to examine the horse's brain tissue. The farmer's diagnosis was correct. His horse did have rabies. We gave the farmer rabies, tetanus, penicillin, and gangrene shots and hospitalized him for several days. This is the only occasion in my practice that I knew of a rabid farm horse. The 10 most wanted. Doctors and FBI agents have one thing in common. They both have a list of their 10 most wanted. The FBI puts up a list with pictures in the U.S. post offices, and West Virginia doctors post a warning story in the West Virginia Hillbilly newspaper. In 1988, I became concerned about a small tick whose bite could prove deadly, so I wrote the following article for publication. Tick bite fever of deer and white mice is a disease caused by the little tick with the orange belly. The tick is Exodus damni, so I guess this must be a damnable disease to youngsters who get bitten by this tick. The tick itself is small, about as big as the O in ouch. I have just been bitten by a tick. If you have missed finding the tick, look for the rash in 3 to 28 days. It is chronic red rash with raised area around the bite, and it grows to be 6, 12, or 18 inches or more in size. It is like a brush fire. It spreads out or migrates outwardly and lasts for days. Doctors and nurses have a name for this chronic, long-lasting red rash that migrates outwardly. Chronic erythema migrans is the official name, better known as Lyme's disease. Can Lyme disease be serious or just another chronic rash with pain? It can be both. The disease manifests itself with some of the following signs and symptoms: as a flu-like illness with fatigue, headache, fever, chills, sore throat, stiff neck, pain in the chest, leg or back, pain in muscles and joints with recurrent joint swelling, dizziness and sun sensitivity. It can cause meningitis and be fatal. In pregnant women, it can cause a miscarriage. Lyme disease imitates juvenile arthritis in children and frequently is treated as arthritis, but unsuccessfully. Mice and deer carry the tick. Where a lot of deer are found, so is this tick. It has not hit West Virginia too hard, but has been devastating in other states. First reported and identified in Lyme, Connecticut in 1975, Lyme disease has infected a sizable percent of the population of Connecticut and Massachusetts. Owners of private estates have taken down their no hunting signs and replaced them with, "Please hunt here with care." Lyme disease outnumbers other tick illnesses more than the better-known Rocky Mountain spotted fever. Chronic erythema migrans, or Lyme disease, is on my personal 10 most wanted list. The tick, Ixodes damini, is very small, but the rash is large and can be readily diagnosed. The treatment with penicillin or tetracycline is effective. The real danger with this little tick is that most cases of Lyme disease are in children. The albino deer. As I was driving to a house call at daylight one November morning in the early 50s, I heard a shot. I saw a white deer with a fine rack of horns fall beside the road. I then watched the pleased hunter quickly walk up to his deer. I knew the hunter, a local telephone repairman. We were on a road just across the county line upstream from Buchanan. I knew that every hunter in the area had been after this unusual albino deer. I congratulated Chester for his kill, and I drove on to make my house call to the sick baby up the hollow. On my return trip, I saw my lucky hunter being arrested. Only buck deer with antlers were legal, and unfortunately this freak white deer with horns was a female. The conservation officer who had come upon the scene was young and gung-ho to enforce the law, especially when my hunter friend didn't want to be arrested. Chester's blood pressure and weight were usually above normal, and I bet to myself that at that moment they were higher than ever. My prescription worked well that morning. I told Chester to accept being arrested, but demand a trial by jury with at least one hunter on the jury. The young officer said, "No jury would convict him, so what is the use of charging him?" "'Tis true," I thought. "You, young officer, are very intelligent, and my friend Chester is lucky to be taking home his albino deer this morning." And that concludes Part 4, Animal Stories, from The Stories of a West Virginia Doctor by Dr. Harold Almond, my grandpa.